Roy Wools, I don't know if I'm getting the whole name here, from Roy Wools, and I think this follows on. Um, why don't we know more about asymptomatic people? And obviously the dose response to the viral load doesn't necessarily explain it. And are there things that we know that can explain why people are asymptomatic or not?
You know, there's a lot of work going on that, and we just don't know. Both in terms of why they're not more likely to get clinically ill, but also how infectious are they and when. A lot of work trying to go on there. One of the problems with having asymptomatic people is how do you find them at the time they're asymptomatic, and so that you can get them in and test them. And there have been some studies trying to get contacts of cases to enroll so that they can actually look more carefully and try to anticipate that. It's hard to get somebody coming into your study the day that they're going to become infectious but not ill. You know, how do they know it? And so that's been a challenge, but this is a really good question. We have a real need to understand asymptomatic infection, how much transmission occurs, when does it occur, and what that all means. So I would agree with you, and I think this is one of the priority areas we need to really continue to work on in terms of better understanding this infectious agent. Remember, it's going to be around for a long time, so it really is important we do understand this.
And his name was Roy Woolsey. Secondarily, what about vitamin D? We've been hearing links
there's been
to
lots
that.
of things put forward about zinc, vitamin D, etc. You know, we've looked at these, and there just isn't any at all clear, compelling evidence that they make a difference. You know, it was suggested if you just vaccinated people with childhood vaccines, it stimulates the immune system. You know, where that's been looked at, BCG, all of these, none of them have really panned out to show any benefit. You know, I worry that we are focusing on kind of the, hydroxychloroquine type approach where, we have some anecdotal evidence from somebody who swears that 12 of his or her patients were saved because of this, taking this particular product, whatever. And, but we just don't have any compelling data. I mean, everyone would be willing to put whatever we could forward for research and development if there was even a simple sense that it was making a difference, and we just don't have that for these.